Welcome back. You're watching Morning Express, and it being a Wednesday, we like to focus on your health. Now, today we're going to focus on the oxygen availability in the country. This is an issue that has been highlighted in the press. We had CS Mutahi Kagwe making an appeal to Kenyans who are holding cylinders to let go of them so that we can have oxygen in circulation. And of course, this is something that is going to be very key that we have to explain to you, of course, as our viewers. And far from that, we would also like to know how the business of oxygen works, and we are going to be focusing on that, and of course how recent developments in the country have led to a scarcity of oxygen. And joining me to dig deeper into matters oxygen is Nitin Monga, Business Development Manager of the Nairobi Enterprises Limited. Welcome to the show.
Thank you.
Now, let's just start off from that presser that was given off by the CS, making an appeal to Kenyans everywhere, if they're holding on to cylinders, to let them go so that we can have them in oxygen in circulation and used for the more critical needs. Why would this be happening? Could you explain to us how a country could get to such a position?
You know, a lot of people who are not in the healthcare setting actually don't really understand that oxygen cylinders are very critical, especially in the treatment of COVID. You will find someone having multiple cylinders in their houses, probably 3 or 4, as a buffer, that they might run low on oxygen. But in the same process, institutions that need to refill this entire setup of oxygen will not have cylinders, and thence they will not be able to supply the institutions. Okay. So with the coming in of the manifold, you know, it's really helped that you can use one source to give multiple patients, but that source also has to be replenished.
Okay, and how is it that people are having multiple? Isn't there a cut-off, or rather, there are mechanisms that you know, hold back how many cylinders you can have? And how come the country does not have as many as we would like to, so that even those who feel the need to stock up can? Because I don't think there's anything wrong with wanting to be safe enough in case there's a shortage.
Unfortunately, there is no capping mechanism. It's purely a matter of how much you can buy. Okay. Over the years, we've not had this challenge. Of course, oxygen being used for industrial purposes as well as medical purposes. People have been able to keep stock. Unfortunately, or rather, let me say, COVID being a respiratory disease, it actually needs a lot of input in terms of oxygen therapy. Now, when this oxygen therapy is required, it means an influx of demand in all institutions, obviously creating a shortage. A lot of the oxygen from the industrial sectors has been moved towards healthcare settings. Yes. But as the minister had said initially, that all these cylinders that are lying dormant in people's houses or warehouses or workshops need to come back so that the cycle is fulfilled. Okay. Unfortunately, cylinders only do not satisfy the need. People who are using cylinders can also go to other options like oxygen concentrators, which are available, not readily, but they are available. There are other alternative sources of oxygen.
Explain to us what those are, oxygen concentrators.
Okay, oxygen concentrator is actually a small device that actually takes air from the atmosphere and purifies it to give you oxygen at a higher capacity. So you really don't need to put in a plant, or you really don't need to. All you need to do is just to plug into power, and the compressor will run and pick up absorb the atmosphere, purify, and give you oxygen on your pipeline or on your nasal cannula. Unfortunately, it only works one patient per concentrator. Okay. It can be used in a hospital setting, but of course, with the upsurge of numbers, it's very difficult to, you know, give multiple people the same oxygen from that. Hence the need for the cylinders or an oxygen plant that goes into the pipeline.
Absolutely. And while we are dealing with an upsurge of coronavirus cases, that means there's a need for more oxygen and those cylinders. But at the same time, we still have other things that require, other conditions that require the supplementary oxygen. Could you tell us about that, and how now when you pile coronavirus onto those, we have then a crisis?
Definitely, a lot of other cases are required. There is a lot of use of oxygen in the ICUs and in the theaters. And definitely with coronavirus coming in, we have an upsurge of close to 60–70% of the cases being detected as critical with the need of oxygen therapy. So the only other way to mitigate this situation is actually by upgrading or scaling up.
Yes.
Scaling up can be done in multiple ways. First, actually having a national oxygen production facility. Of course, that's a long shot at the moment, but for now, a lot of private institutions and government institutions have actually started revamping their oxygen plants.
And I was actually about to point out that the people in the business of oxygen, to a layman who does not understand the upgrades that are needed and the health systems that we have, they would think that you should be celebrating right now. But are you really?
Not really. Not really. I think this is becoming one of our pain points, especially for distributors like us, who have to actually import plants and revamp plants that are existing on the market. A lot of the upgrades that are being done by every institution are usually on bed capacities.
Okay.
So when you increase your bed capacity, oxygen plant becomes a capex expenditure, which requires a lot of input in terms of funds. These are funds that hospitals or rather institutions feel that can be utilized in other things like ICUs and all that. So we've never had a situation where we've had to use 80 or 90% of our bed capacities. But today we are overflowing. We don't have bed capacity at all. There's no space in any of the ICUs, or let me say most of the ICUs. So all this oxygen that is required has to come from somewhere. Now, this overwhelming demand in all institutions has pushed institutions to think in terms of revamping the existing structures. And this is where we come into play, where we come and actually repair your existing plant or upgrade it to a bigger capacity.
Yes.
Okay, either by changing parts or actually placing in a new plant. So Nairobi Enterprises has actually taken the initiative to import multiple number of plants, and have the pipeline running despite the fact that it's a global demand.
Absolutely, it is a global demand. Could you also explain to us how that is affecting how you can operate, because you're trying to get and supplement in the country, but at the same time, we've had a lot of talk of government institutions, improving their systems. Isn't there a more private approach that wouldn't have to deal with the rigmarole of government systems and all that a lot of people want to just push aside and find a way of getting their oxygen? Is there a way around it, or does it have to be through government system?
Not really government. A lot of private institutions are also trying to help. We've heard of people trying to donate oxygen, but the only challenge is that they say, bring your cylinder, we fill it to you.
And then there's no cylinder.
There is no cylinder. So what we've done is that we've partnered with several banking institutions, we've partnered with our suppliers, and we are also offering lease mechanisms. These are lease mechanisms, right? These are rent to own mechanisms, or rent to keep on renting until you actually feel comfortable enough to buy it.
Okay.
And we've also partnered with a lot of, faith-based institutions, the likes of Hindu Council, by providing, very minimal-based oxygen concentrators at a very low price, so that they're able to actually help people out there.
And when you're talking about leasing, then that brings in the question of cost. What is this to a common mwananchi who is not earning very much, or perhaps is not even in having a regular paycheck? How would affording oxygen impact their liquidity, especially in times such as these? Is it even affordable to start with?
To be very honest, the leasing option eventually is expensive.
Yes.
But then if you're able to pay for your plant over a period of 5 years or 10 years, depending on the capacity that is required, you see, then you just pay a monthly fee for at least a sure shot regular supply of oxygen.
Yeah. And what are the other solutions that you as Nairobi Enterprise Limited would be offering to ensure that this crisis is dealt with from a business perspective as opposed to the health services perspective?
As I said a bit earlier, that we are already partnering with a lot of institutions. We've partnered with the likes of Avenue Hospital, Nairobi Hospital. We are working with Aga Khan Hospital, St. Francis, St. Luke's, Top Hill. We've worked with a lot of institutions, and we've offered them very easier terms as much as we could.
Okay.
Of course, there is a business perspective to the entire deal, but there is also the fact that we are able to provide you with the full-fledged backup in terms of maintenance, and over the period of the lease or the hire purchase, you don't have to cater for that cost.
All right.
We will take care of it, and we'll make sure the plant is running till the life of the plant is existing.
Okay, and if you were to paint an ideal picture of what you would like to see in this country, maybe you could compare it to the countries that are more developed in terms of their health systems. What would you like to see, and what are the lessons that we should be learning from the current oxygen crisis that we're experiencing right now?
I think the current oxygen crisis has actually put the entire world at a stake, and that actually puts in a lot of focus on the things that we need to prioritize. Unfortunately, oxygen therapy was just put on the WHO requirement list in 2016. This is a fairly short period of time to be prepared for. But the pandemic coming in is actually telling us and teaching us that we need to be better prepared for unexpected eventualities.
And if you'd go to a local hospital right now, as is, because I'm sure you've gotten access and you've seen what is happening, what would you like government and county governments to prioritize to ensure that everything is there, to ensure that those who need oxygen get it on time, and of course those cylinders, should the country be having more cylinders? What practical ways can local governments actually put in place to ensure they're dealing with this?
I would actually propose that the sure short way of dealing with such scenario is actually having your own plant. Okay. Because you produce your own oxygen, okay, as your capacities increase, you're also able to increase your supply chain. Okay, if you are surplus, you're able to, you can actually put in a refill station.
Yes.
So you can actually store some of the gas instead of waiting for a third-party person to bring it into you, who might also be having challenges as the cylinder. Increasing cylinder capacity is one way of dealing with it, but it's not a permanent solution.
And do you understand that you do work, aside from your collaborations, are there other ways in which that you work with charities to help the people at the very, very bottom of the economic sphere to ensure that they can actually just get oxygen for themselves?
Yes, we do. Actually, apart from being distributors, we are also manufacturers of PPEs and masks and a few pharmaceuticals as well. We are one of the few industries that are lucky enough to stay afloat during the COVID period, and we are managing to employ quite a number of people.
Right. And far from that, let's take a look at this story by... we don't have that story yet, but as we conclude the conversation, I'd like you to perhaps point out something about the oxygen business that you'd like Kenyans to know, that there perhaps is a misnomer or something that is misconstrued by viewers or most Kenyans that you would like to bring to understanding.
The oxygen business is a very complex set of business. Reason being that it has a number of components that need to be specialized. Your compressor size, your pressure size, your purity levels. These are highly technical products. Okay. Unfortunately, the technical know-how in this country is very limited.
Yeah, and thank you so much. Perhaps your concluding remarks on this subject?
We are there to assist as much as we can, and we are open to all sorts of proposals that come through to us. we actually do hope that...
so proposals for collaborations.
And we are also willing to partner with other institutions that have not actually gotten in touch with us, and the government as well. We are already working with a number of government agencies in this process, and also in touch with the minister himself.
Okay, thank you so much. That is Nitin Monga, the Business Development Manager for Nairobi Enterprises Limited, talking to us about the business of oxygen and the complexities of that have been brought on by COVID-19 and all the other needs of oxygen in the country. Thank you so much for making the time to join us this morning and help us understand more about the need of oxygen in the country. And now here is a story by Akisa Wandera on the same, just shedding a light on the situation in the country as far as the need for oxygen is concerned and how coronavirus has made this a thorn in the country's side.
An oxygen cylinder and a number of pipes. This is a life 22-year-old Brilliant Wangoi has known for the past 12 months. A cesarean section operation gone wrong left her dependent on medical oxygen. She literally hangs on to this constant supply for dear life.
Age 25 nilijifungua through CS. Hapo ndo nilianza kuugua wakati mtu anapewa ile time ya kurecover after kujifungua. Nilikaa for 2 weeks bila kufanya kazi. Venye nilianza kufanya kazi nikarealize nikifanya kitu kidogo na nachoka na anza kuhema. Niko admitted already masimisha. Akasema nikidischargewa nikuwe discharge na kama tumepata oxygen concentrator. Ati juu I need oxygen. Yani siwezi kaa, pia ni mapafu yangu hawezi pumua mwenyewe. Sasa nda discharge tu kama niko nayo kwa nyumba.
The presence of this oxygen cylinder smack in the middle of this one-room house that Brilliant shares with her grandmother and her 1-year-old son in Bondeni, Nakuru County, is not the biggest of her worries. The price of this precious commodity is...
Hiyo cylinder ya kwanza tulikuwa tuna refill na 1600, which ilikuwa kwa siku sijui tuna refill mara ngapi. Ilikuwa inaenda haraka. Mami kaona inamshinda, imekuwa expensive. Saizi hata siwezi kuambia mama kuna deni kiasi gani hapa. Madia anaogopa kwenda kazini juu ana deni za watu. Alafu tena kwenye watu tunachukua oxygen tuko na deni.
The average cost of refilling an oxygen tank for home use is 1,300 shillings. However, a recent spike in demand has seen the prices double. For Brilliant, she needs 2,500 shillings daily to remain alive.
Imekuwa complicated. That hata mimi mwenyewe siwezi kuambia aswana atakuwa treated for what. Mimi ningependa tu mnisaidie. Well wishers wanisaidie tu. Hizo kupata hizo vitu. Kama hiyo maziwa ya mtoto. Mimi kupata chakula, dawa na oxygen. Sitaki hata pesa. Nataka tu mtu anileteage ndio hiyo oxygen, ndio hiyo maziwa ya mtoto. Hivyo nita appreciate you. At least life yangu. Cause ukweli siwezi kwa promise nitarecover kama nina stress hizo vitu. Naonaga hii oxygen ikiwa imefika kwa 0 naanza kupanic. Juu ikiisha sina national tatu wapi 2,500.
Only one person works in this household, her grandmother. She sells tea, which doesn't make her much to meet the constant bills.
Hii mtungi kila siku. Ikifika kama saa hii, wananipigia simu. Wananiambia mtungi imeisha. Naambia, ai, imeisha na sina pesa. Nikiwa tu hapo kazi nilikuwa nauza chai kichinjio. Naambia watu mimi sijui nitafanya nini. Mtungi imeisha na sina pesa. Wananiambia shika inatosha. Naenda nanunua. Siku moja nikaambia msichana wangu nikitoka kichinjio, mimi kesho hii mtungi kiisha sitakuwa hapa, mimi naenda, mimi natoroka. Akaniambia utoroki mama.
It's a high price to pay for a commodity many breathe freely every day, yet remains ever so rare for those who need it the most. Thanks to the raging third wave of the coronavirus pandemic that has seen an acute shortage of medical oxygen countrywide, some have had to pay the ultimate price. Embu-based journalist Ruben Githinji was one such case. The 52-year-old's last dying days involved family and friends running around to secure him oxygen and an ICU bed to save his life. His wife, Purity Murage, remembers this all too vividly.
Nigonjeka on Saturday, tukashinda Saturday na Sunday. Sunday nikampeleka hospitali, county hospital, wakanituma referral general. Nikaenda General Hospital, akawekwa oxygen na akakaa kwa oxygen for a few days. Afterwards daktari akaniita akaniambia hakuna oxygen mzuri na anaendelea akiwezwa sababu oxygen ya General haifanyi. Sasa nikaambiwa nimtafute Nairobi hospitali, tukatafuta nyingi sana kwa government sikakosa kabisa. Tukaanza kutafuta private ikawa too expensive, but at long last tukapata Murang'a Hospital.
Ruben would later succumb to COVID-19. The crisis has left a trail of death in its wake, pain and more questions than answers in slightly more than a month. The third wave has seen a jump in the number of COVID-19 patients in need of oxygen. In March, for instance, the Ministry of Health reported that 68 patients were on oxygen. 40 days later, on April 11th, a total of 482 COVID patients were on oxygen, with the supply said to be limited.
We're having a problem with delivering oxygen to our patients, especially now with the resurgence, or should I say the so-called third wave of corona, which has put a lot of pressure on our oxygen supply. So the demand is really outstripping the supply.
Statistics from the Ministry of Health also indicate that before the pandemic, the average demand for medical-grade oxygen was 410 tons. But as of March 2021, the demand went up to 880 tons, up from 560 tons in January this year.
From the simple lack of oxygen delivering to them. I want you to put this into perspective, Kisa. Typically, again, pre-COVID, most of the patients that we were giving oxygen, the maximum, in most cases, was 15 liters per minute. We give it in liters per minute. Mostly it was somewhere between 2 to 6 liters per minute, but for isolated patients, you would go to 15. So maybe an average of 5 liters per minute. Right now, we have patients in our ICUs who require flows as high as 60 to 70 liters every minute. That is 12 times what we have been having. So the plants we've had have been producing oxygen just enough for us to give 5, maybe 10 liters a minute. Now we need 12 times that.
Hospitals across the country are already overstretched. Last week, Kenyatta National Hospital suspended planned surgeries indefinitely following an acute shortage of medical oxygen.
A typical level 4 or level 3 hospital could have probably just had 1 cylinder, maybe 0. With some luck, they would have 2. As you go up, then you get more and more cylinders in the hospitals. Right now, the demand has become so big that this is just impossible for them to supply.
Kericho's Siloam Hospital has also asked other facilities not to refer COVID-19 patients without adequate oxygen supply in the ambulance.
Hospitals who are referring people to other hospitals, make sure you have enough oxygen in that vehicle bearing that patient to another facility. It is no need to release a patient from a facility with 1 small cylinder of oxygen. You need to put in what you estimate is enough to reach that patient to the facility.
In 2020, the government set up an oxygen task force, which according to the Ministry of Health, has since identified issues of service, maintenance and operations and piping as a requirement.
We are trying to play catch up. Yes, I agree with you. We should have probably, where we sit, we ask the question, how can we increase the supply and the access? So identification of these dormant plants that can be reactivated. A number of counties actually have taken up this, even going ahead to pipe this oxygen to the patient area where the patients need the oxygen. Because you remember I told you one other problem is how do you get the oxygen from where you've produced it to where the patient needs it.
As the struggle continues for those still hanging on like Brilliant, and while others grieve the death of their kin as a result of this crisis, all eyes remain on the Oxygen Task Force and the government at large and how fast they are able to turn the situation. Akisa Wandera, KTN News.
Thank you, Akisa, for that one. A truly sick situation the country is going through.